Good morning, everyone. My name is Kelly Caseman. I'm the Executive Director of Think Kids, and I'm thrilled to welcome you to Session 3 of the 2021 Regional Health and Hunger Summit Series. This is a virtual series as part of our larger project where we take a candid look at connections between the healthcare system and community resources that address hunger. For this series, we're looking at these connections in 3 counties in our state: Boone, Lincoln, and Logan. Health and hunger are profoundly connected. Their systems should be too. You can find more on our website, thinkkidswv.org, and on the Think Kids Facebook page. And we hope you'll help us and join in the discussion, because now more than ever in this moment, we need to unite in our efforts to ensure that all West Virginians are as healthy as they can be with access to healthcare and nutritious food. There are a lot of challenges to this, and I've met some great people in these counties who are leading efforts to build these bridges. And so we're glad you're here with us to meet them and join in the conversation. Let's get started. Now, we know that a lot more West Virginians than usual are on the internet right now. And so if you get disconnected, please know that this is being recorded and will be shared on our social media sites tomorrow. Also, you'll have the opportunity to share your thoughts and ask questions at the end of the panel discussion. Go ahead and type them in the Q&A, and we'll get to them at the end of the discussion. With that, let's get underway by thanking our main sponsor for the event series, the Palatine Foundation of Huntington, for their generous financial support, and our community sponsors, which include Pride Community Services, the Salvation Army, and Unicare Health Plan of West Virginia. Here is our agenda for today's session. We'll begin with a brief look at some statistical data about the geographic regions that are part of this summit series. Then we'll turn the video over to our 3 presenters, and then we'll circle back to questions from both you if you have them, and some pre-prepared questions we have as well that we created in the process of planning this session. And with that, let's look at some Feeding America Map the Meal Gap data from their website. If you're a data wonk, here's some good news. You can request their full data set via email. But these percentages are a little old. They're from 2018. We'll go in alphabetical order and look at food insecurity in Boone County, which has a reported 27.8 food insecurity rate. We sometimes talk about the federal poverty level or line needing to be recalculated, that with time it has become too low. For a family of 3, the poverty line used to calculate SNAP benefits in the federal fiscal year of 2021 is $1,810 a month. Thus, 130% of the poverty line for a 3-person family is $2,353 a month, or about $28,200 a year. The poverty level is higher for bigger families and lower for smaller families. You may want to keep that in mind, as these numbers and federal policies are based on the FPL designation. And so we see of those designated as food insecure, 74% fall below the SNAP and other nutrition programs threshold. The average SNAP recipient receives about $127 a month, or about $4.17 a day, or $1.39 per meal in fiscal year 2018. If you calculate the cost of a meal at $2.75, it will take $1.8 million to meet the food needs of those who are insecure in Boone County for 1 year. As we've discussed in previous sessions, the demographics between Boone and Lincoln are similar. Their food insecurity rate in 2018 was a little higher at 27.9%, and a higher percentage living below this SNAP and other federal program threshold at 78%. With meals a little more expensive in this county, it would take over $1.9 million of an annual budget to feed those food insecure in Lincoln County. Logan County has a higher population with a slightly lower level of folks living in poverty. The percentage of those who are food insecure is 26.3%. Keep that in mind that the national average in 2018 was 11.1%. With an average meal costing $2.71, it would take nearly $2.8 million to meet their needs annually. And so now that we have a little context around the health of the residents in Lincoln and Boone and Logan County, let's begin by introducing the first panelist. This is Chad Akers, and he is the director of Hungry Lamb Food Initiative. This, by the way, isn't his only job. Chad is a licensed funeral director and owner-operator of Akers James Funeral Home in Logan. Hungry Lambs provides food to approximately 200 families per month. Chad is a volunteer mentor for the Fresh Start program and has worked with the program participants for over 3 years. He's actively involved in the gardening aspect of Fresh Start and initiated the expansion of chickens to the garden in 2019. Chad's organization and leadership skills have helped to continue the pantry throughout the pandemic while involving the participants of the Fresh Start program in all aspects of the pantry to keep both programs working through 2020. Welcome, Chad.
Thank you. Nice to be here. Just want to thank you for having me here today. To be able to talk about what we do. In Logan County, there is a huge demand for the food pantry. We see numerous people each month. Our numbers during the pandemic went up quite a bit. We're starting to see them come down a little bit right now. But we're averaging anywhere from 175 to 200 families a month. But we aren't seeing the same people each month. It's different groups. Sometimes we do have the people that come all the time, but every month we are seeing new people show up in need. So Logan is really hurting in that area, and I'm really looking forward to this today to hopefully find some new contacts and some ideas from people to help us out and be able to serve as many as we need to.
Thanks. So let's take a moment and show the video of that. Well, maybe you can set it up for us and then we'll watch it.
Back in December, we decided to try to do a promotion, not really a promotional video, but just something to help us show the need in our area and to help us also try to receive some donations for what we do. And so we shot this video just to show the need that we have in our area. And, I'll just be quiet and maybe let you show the video right now and people will understand what we're talking about.
The Hungry Lambs Food Initiative is a nonprofit food bank that serves residents in Logan County, West Virginia. Founded in 1991, the pantry partners with the First Presbyterian Church of Logan, the Logan County Commission, and the Fresh Start program. The initiative relies on its partners and the contributions of community members and organizations to fulfill its mission of feeding hungry families. As the economy of the region was further devastated by the COVID-19 pandemic, more and more citizens turned to the pantry for food to help keep their children, grandchildren, and their neighbors from facing extreme hunger. The pantry did not stop. The group of volunteers worked together to find a way to reach as many families as possible who were in need of food. On December 18th, 2020, the Hungry Lambs Food Initiative provided food to 320 Logan County families. The average number of families seeking food continues to grow each month, and Hungry Lambs feeds as many as possible with the help of its partners and friends, churches, and community members who support its cause.
A little bit about our food pantry. It started in 1991 at the First Presbyterian Church of Logan. It started out as a very small program, and then as the years went on, it grew and grew and grew. And now we are located at the Logan County Resource Center, which is in Peach Creek, West Virginia, which is the old 84 lumber building. And so we have gone there. And so when it started there, when I got involved, it was not a drive-through food pantry. People came in, they were able to walk through and kind of pick out some things that they would want. They were limited to what they could get. But then, when the pandemic hit, most of our volunteers were senior citizen ladies from the church. So with the pandemic, they were not able to come back and help. And that is when we got involved with Michelle and her Fresh Start program. They stepped up, and we have 10 to 15 volunteers every time we do it. We try to do it at least every other week, but with the pandemic, it kind of, our schedule got off. So when like I said, with the pandemic, that's when we turned it into a drive-through. So basically, like you saw in the video, people pull up, we find out, we have someone that goes to each car, they find out how many families they need that they are there for. We put a little post-it note on the windshield, so as they pull up, we know this might be one family, it could be 5 families that we're feeding, so we know that's how many boxes we need to put in their vehicles. So it's been a really good program, and has grown, and now people know what to do when they get there. They just pull in and they get in line, and there's no question, everybody kind of knows what to do. Along with the Fresh Start program, we even now partner with the quick response team in Logan, which is a team that goes out and tries to make contact with people that have survived an overdose. We were lucky enough that we received a grant from the Palatine Foundation. And with this grant, we are able to, we have duffel bags that we fill full of food, bottles of water, just easy things that people can eat, snacks with like cheese and crackers, Vienna sausages, just things like that, personal hygiene products. And also in those bags are information on how to receive help, substance abuse help, if you need treatment, or our phone number for if you need more food is on there. So it's just some things like that we have done during the pandemic, and the bags are going over very well. Spoke with John Kangas, who's the director, who is the recovery coach that goes out on the QRT, and he has said that has really helped them making contact with people, that they need to try to get into recovery or get into treatment. It kind of gives them a way to, I guess the best way to put it is break the ice to make that contact with that person. So that's just some of the things that we're doing right now.
I have a couple of questions for you. So you said that you started Hungry Lambs as kind of an offshoot from your church, correct?
Yeah, that's correct. Actually, my mother and another lady started it back in 1991. They got a nice donation from a local gentleman that ran a business in Logan, and that's how it got started. And they basically started, like I said, in the church with just a couple of little freezers and some things, and it wasn't very big. But then as the need kept going and growing, they had to take more rooms at the church, and then it got to the point to where it had to be moved to the resource center at Logan County. And we were fortunate enough that our county commissioners here at the time, they know the need that we had, and they were willing to give us space in the resource center, where we have now we have walk-in freezers, walk-in refrigerators. So it really helped us. And honestly, we're kind of outgrowing that space a little bit right now, but we make the best with what we've got, and we're appreciative of what we've got there. And so, we do the best we can with it.
So you have really expanded over the years due to need. So it was kind of a supply demand.
Right.
And did you step into the job because somebody needed to do it? And
well, I kind of just got volunteered into it, I guess is the best way to put it. They needed some help, just doing some of the organizational skills of it and everything. And so I kind of just stepped in to help. And so for the first few months, I was just there kind of just helping them a little bit. And then the pandemic hit. And then that's when, like I said, the majority of our volunteers were senior citizen ladies. And I'm talking in their 80s and 90s. So that's kind of how I got into the role as the director now. So it's just kind of gone from there.
We've heard that a lot. We've heard that, many of our pantries are staffed by older volunteers. And so when we kind of had this pressure on a makeshift infrastructure around the state, we had people who were really not in a place to take on that role. So they were very lucky to have you. So I saw in that video, Dr. Ellis. Can you tell us a little bit about your partnership with Coalfield Health?
Coalfield Health, they have really been great. they came and just they wanted to volunteer. They saw some things that we were doing, and they asked if they could come and volunteer. They have actually done numerous things, and there's some of the things that they've done that I'll have to kind of let Michelle touch on because she knows a little bit more about it. But one of the things they've done, once the vaccines started coming out, we kind of again had to change when we did our food pantries because the health department, Coalfield Health, all the partners were there at the resource center doing the vaccine clinics. Well, we talked about it and they saw the need and the idea, and we actually one morning when we had our distribution, they came and went car to car and did vaccines. So, they found that a lot of the people already had their vaccines, but they were able to that day, I think they gave maybe 35 to 40 vaccines to people that otherwise didn't have the opportunity to get a vaccine. And there's some other things that we have been talking about. Before the pandemic hit, we had a satellite health department in the same facility where the food pantry is. So at that time, people would come and they would sit in the waiting room, the lobby area, waiting for the time to get the food that they needed. So at that time, they could walk over to the health department and get blood pressure taken, just any information they needed, health screenings, everything. But when the pandemic hit, that kind of had to stop. So we're talking about now maybe trying to set something back up through the health department and Coalfield Health to come, and if it has to be outside, they can set tables up and do some screening, blood pressure, diabetic training, anything like that we can do. And we could set back up inside and people just wear their masks and not only have a few people in at a time, but they have been wonderful with the things that they have done with us, and very, very helpful, and just are motivated and are willing to do anything we need them to do.
So before we move over to Michelle, I just want to ask, do you think that the sheer proximity of having all of you in the same place has really fed and expanded the collaboration between these systems and resources? Did you hear me, Chad?
Oh, I'm sorry. I thought you were asking Michelle. Okay. Yes, it has really been a big help to have everything there together. It's the health department was located in the courthouse. Well, a lot of people don't feel comfortable going into the courthouse to the health department, whereas now, if it's there, the satellite department is with us in that one building. It makes it a lot easier for people to access to be there to get the treatment that they need. So it was a great thing that they started. I would suggest that for anyone, if you can do that, to do it. As many resources as you can have together in one place, the better off you're going to be. So we've even had just another resource, our ambulance authority, Logan Emergency Ambulance Authority, they have been there and done COVID testing while we're doing the distributions. So it's not just we've done vaccines and we do testing. So the more you have there, the better off you're going to be. The best way to put it is just your one-stop shopping, really. Everything there. So if they have the resources, they're going to take advantage of it. But if you don't have it there, then it's not going to happen. So the more you can have, the better off you're going to be.
Right. Can I ask you one more question? So say that somebody comes for a vaccination and they identify that they're food insecure and they want to access resources for Hungry Limbs. Do they have to fill out any kind of form?
We do have a form that they can fill out. They just all we need is their address, a proof of address, and income, and we will help anybody. If they tell me they need food, I'm going to give it to them. We get messages all the time from people through our Facebook page that even if they're coming there for the vaccination, we will take care of it. But if they can't make it to us, then we will go to them. That's one of my next projects that we're wanting to do is we would love to be able to have a refrigerated box truck that we can go out and hit different communities. Because where we are, a lot of people don't have access to getting to us. So like I said, we do get messages every now and then of people that need food. Just for example, the other day I had a lady message us. She had 3 small children. She had 3 other adults living in the home. Their car was broken down. She said, we have nothing. She said, the kids aren't in school right now. They're not getting their lunches from the school. I'm sorry, she said that's the only thing they're getting is just their bag lunch from the school. So of course, I said, give me a few minutes. I said, I will load stuff up. And I met them in an area close to their home that they could just walk. So that's the thing. That is I went in my personal vehicle. So that's, if we had access to a box truck that we can load things up, we could do different communities each month to where it would make it easier for people to get to us. And I think we could serve a whole lot more people because, like I said, there are numerous people that can't get to us because they don't have transportation.
Could you speak a little bit to the need? So, I think that you're the first panelist that we've spoken to in depth who serves Logan County. We've spoken to Boone and Lincoln, where they've said that there's definite pockets of abject poverty where it's just virtually impossible for folks to get out or for folks to get in. Is that the case in Logan as well?
Yes, that back to what I was saying, there are areas of Logan that people they can't get out. They don't have transportation. And as I said, if we could be able to go and set up in other areas, then we could help take care of those problems.
So let me ask this before I transition over to Michelle. We've heard this before. This came up in one of the sessions, and it's come up in discussions in 2020. And one of the concerns was, kind of the logistics of having this kind of truck. Who's going to drive it? What does the insurance look like? What does the look like bringing on staff? Are these concerns that you have as well?
Well, I mean, we are fortunate enough that the insurance and things like that would not be a problem. We have volunteers that's their job is insurance agent. So I'm not really worried about that. I do have other volunteers that are some gentlemen that are retired that they go anytime that we find out we have food that we can go and get, we have a box trailer. It's not a very big one. They go and get it. So drivers would not be a problem. I mean, if I have to drive it, I'll drive it myself. But that to me would not be a problem because we have volunteers and that would do anything that I ask them to do. So, and that's the thing is just, I'm not afraid to ask. So, if I ask them if they can do it, they'll do it.
That is fabulous. Now I'm going to ask you some more questions at the end after we talk with. So thank you very much. And we are going on to your better half. Next up is Michelle Akers, Executive Director of the Southwestern Regional Day Report Center. Michelle is a licensed clinical psychologist and Executive Director, as I said, of the Day Report Center. She is a project administrator for the Fresh Start Treatment and Reentry Program, which works with Hungry Lambs, a long-term intensive outpatient program working with persons suffering from opioid use disorder. Fresh Start combines substance abuse treatment with gardening, community outreach, and community mentorship to improve recovery. She helped design and develop the Fresh Start program, which works in partnership with Hungry Lambs to combat Logan County's food insecurity. She works collectively with the Logan County Quick Response Team to meet the hunger needs of persons who suffer from OUD. Michelle, the floor is yours.
Thanks for having me. I appreciate the opportunity to speak about Fresh Start and the things that we're doing to partner with Hungry Lambs and some of our other community partners. Fresh Start is a program that we developed back in 2016. And we started it because we needed just some extra recreational activities for some of the folks in our program. And so one of our employees at the time said, how about a garden? So we got a few raised beds and just started growing a few different things. We found that basil, for some reason, we were really good at growing basil, but the participants at our day report center really responded well to the gardening aspect. And we noticed that different people in the community really also responded well to the gardening program and just those few raised beds. And they were more willing to engage with our clients. They were more willing to share some of their knowledge about gardening and to offer time and plants and just help. And so we found a grant through the Comprehensive Opioid Abuse Program, which is now the Comprehensive Opioid and Stimulant Abuse Program, which is a federal grant. So we wrote this program for Fresh Start. And now, since 2017, Fresh Start is in 3 counties in southwestern West Virginia: Logan, Lincoln, and Mingo. We have lots of participants who come through our program. You don't have to be convicted of a felony, as most day report participants are. Anybody that suffers from opioid use disorder or methamphetamine use disorder is eligible for our program. And the goal is to help get folks back on their feet, to help them re-engage in their community, and to help them develop some work skills and get them back in the job force. We have found a lot of success with Fresh Start, and our gardens have really grown. The garden in Logan has a lot of different vegetables now. We have a chicken coop with lots of chickens. All of the vegetables and the eggs are donated back to Hungry Lambs Food Initiative in Logan County. In Lincoln County, we just secured a few acres of land through the Lincoln County Economic Development. And they are partnering with a group in Lincoln County to take the vegetables that they are growing this year, and they will be distributing vegetables and hopefully some meals to senior citizens in Lincoln County at their homes, as well as grandparents raising their grandchildren. And very fortunate in Lincoln County, they're even going to let our participants be a part of not only preparing the food, but delivering it. And so, the impact that Fresh Start has made for our communities, but especially for our participants, it's really hard to describe. It's something you really need to see. And when I write grants for Fresh Start, it's hard to put it on paper because it's just, it's almost like a movement, I guess. But what it's done for the folks that are in recovery and are coming through the program is it's helped them find purpose again in their community. It's helped the community see them in a positive light. In the darkest days of the pandemic, when Hungry Lambs had the highest amount of need, the people that volunteered and were not forced to, they chose to, the people that came week after week were the Fresh Start participants. And, a lot of them have shared that they've been in that situation in their lifetime when they have felt extreme hunger and they just felt such an urgency to give back. And that level of outreach really helps someone in their recovery from substance use disorder. But Fresh Start has also helped people gain employment skills and actually gain employment. And the biggest impact that it's made is that it's just really, the participants have come very connected as a recovery community. And so we are doing our best through Fresh Start to grow the recovery community in southwestern West Virginia, which until recently has not been that great. And so I give a lot of credit to the participants of Fresh Start for all the work that they've done and the staff of Fresh Start. We do use peer mentors. So we do use folks that are in recovery on our staff in Fresh Start. And we do also believe that that's made a huge impact in the success of the program. So that's a little bit about Fresh Start. We have partnered with West Virginia Food and Farm We are starting through Fresh Start a farmers market at the Logan County Resource Center. We're hoping, maybe not this year, but next year, to be able to, if it's still a program, be able to offer SNAP, and so that people can use their SNAP stretch at the farmers market. The Coalfield Health and Healthy, Wild, Wonderful, Healthy Logan County, they wrote a grant through the Palatine Foundation to try to help us get a greenhouse so that we can offer fresh vegetables for an extended season, hopefully year round. We don't know yet if we've received that grant, but we're pretty hopeful in finding in getting some funding for a greenhouse, which would also be at the resource center right there where the food pantry is. We started a tool library in Lincoln County because we know that some of our participants want to be able to start their own gardens at home and to feed their families, but also to maybe sell some of their vegetables at the Lincoln County Farmers Market. And so folks can come and they can, almost like they're borrowing a book, they can borrow some of the tools that we have, which are mostly gardening tools. You have a tiller and, you know, different gardening things you need for gardening. And then they bring them back. They can rent them. Well, they don't rent them. We loan them out for 3 days, up to 3 days at a time. And so we're really anxious about that. We're really excited about that program too. Gosh, I think that's the summary of it. There's probably more, but that's the summary of Fresh Start and the work that it's doing in the communities of Logan, Lincoln, and Mingo.
Great. I have a couple of questions for you before we move over to Brandy, because this is one of the first times during this series that we've started talking about opioid use disorder. So making the connection between the pantry and this program, you know, how did that happen? Is it because of your relationship with Chad? Did it something that just kind of rose organically, you know, that just hit you as something that would be a great partnership?
Well, when we started growing these vegetables, you know, we started out, like I said, with just a few raised beds, but then the next year we had like 50 raised beds. And so we had a lot of vegetables. And, you know, some of the participants were taking, you know, vegetables home, but we just had a ton of vegetables. And so our clinical director at the time, Ashley Matheny, she said, you know, what if we just set up a table of fresh vegetables at the food pantry? So, you know, the participants would wash the vegetables and they would, you know, set it up on a table there, because that's before the pandemic. And so we had just this little table of fresh vegetables. And what happened was everybody really wanted those fresh vegetables, obviously. And so the participants then, who we were letting take things home, didn't want to take them home. They wanted to clean them up and take them to the pantry. And so the participants actually worked that table and made sure that the vegetables were all cleaned. And we even packaged some things together and put a little tag on how you might prepare it, like zucchini and squash. How could you prepare this at home? And so the participants did that. And they just found that we just all found that just was really the direction we wanted to go. And then when the pandemic hit, as Chad said, and a lot of the volunteers were not able to come, the Fresh Start participants said, we'll be there, we'll do it. And they have, and they've come every time, anytime a truck needs unloaded, anytime boxes need, you know, prepared, and they also help with the distribution. A lot of the folks that you saw in that video were Fresh Start participants. They have worked in the rain and the snow, and they don't complain. They really love giving back to their community and becoming a positive member of their community again. So
let me ask 2 questions. First, you know, I'm working on another project where we talk about the effect of the opioid epidemic on kids. And what I found when we started doing these community meetings is a lot of people talking about the loss of that sense of community. Do you think that that's one of the reasons why folks are so eager to volunteer with the pantry?
I do. I think stigma has something to do with it as well. When you suffer from severe substance use disorder in a small town, there's a lot of stigma with that. You're not really welcomed at a lot of places. And rebuilding your life from that is a task that until you watch it, until you see somebody try to rebuild their life, it's hard to even imagine what they go through. A lot of our participants have permanently lost rights to their children. They are unable to find employment. And so, being able to connect back to your community in a way that you're not stigmatized, nobody's judging you. If anything, they're judging you positively. It just really does a lot for your sense of purpose and your self-esteem and your feeling of belonging. And also the community, when we get folks from the community, service clubs, church members, different folks from the community who come and volunteer, they also get an opportunity to see those folks in a positive light. And it's really made a huge impact. And I mean, that wasn't something we were measuring. That wasn't something we were looking for. It's just something that just happened. And people have found a huge sense of belonging from this partnership with the food pantry and Fresh Start. So.
And maybe you can speak to this, maybe you can't. We've worked with a couple of the smaller pantries who were apprehensive, of course, to reopen during the pandemic because, like I said before, they're smaller, they're usually run by their church, and the folks are older. And through these conversations, we had heard a couple of times, we have new people who are now coming into the pantry that we know are experiencing substance use disorder. And sometimes their behaviors can be rather frightening to us. Sometimes they leave their clothes in the bathroom because they came in to kind of change. And what would you say to kind of help address, apprehensions or ways to better connect with the community?
I would say welcome them, thank them for their help. Some of the most giving hearts are people who have experienced exactly what a food pantry services, and that's people who are hungry. So if somebody's there and they want to give back and they offer to help, that's just where it should end. Thank you for your help. This is what I need you to do. And then, and just talk to them, get to know them a little bit. Find out about their families, find out about, what their struggles are. Filling boxes for a food pantry, that is as a psychologist, that's some of the best therapy because you're standing there in this assembly line for a few hours, just, in this monotonous task. And you really learn a lot about people that are also in that line, filling those boxes. And such a sense of, I guess, I would say like a sense of family, and helping people feel like they belong and they're wanted is one of the best things that we can do to help somebody. So I would say just welcome them, thank them for their help, and give them a job to do. And that's all.
That's great.
They wouldn't be there if they're there for the right reasons, or they wouldn't be there. So
my last question, you have talked about writing a couple of grants. Clearly you work for a government agency, correct? So
correct.
Do you find that federal and state grants are kind of responsive to the work that you do?
Yes, they are. Federal and state grants, we operate right now under 4 state grants and 2 federal grants. It's just the management is a lot. And it's, it keeps us sustainable, but it's year after year, we're trying to find more grants and more grants. Fresh Start's grant ends September of 2021. And we know that the Fresh Start program can't end. And so we're really looking for opportunities. And, there have been some wonderful, wonderful people who have who have, given us grant ideas, like, why don't you apply for this or that? But we need to be a 501c3, and we're not, we're local government. So like, we're not allowed to apply for USDA grants, for example. The National Guard has wanted to help us. So we have a meeting this Friday to figure out what could our next steps be and what can we do, because a lot of these ag grants, who would have thought, but there are a lot of agriculture grants that are tied to substance use disorder treatment and substance use disorder. So, and there's a lot of programs out there that do link the two together. So, but we just have to, qualify for those grants. And unfortunately, for a lot of them, because our fiscal agent is a county government, we don't qualify. The reason that is because when day reports back in 2012, the state made day reports, which at the time were really community corrections programs, part of local government, so that the local government would have more buy-in, primarily to try to help reduce the cost of the jail bill. But our day report is actually also a licensed behavioral health center. So we're a very unique entity in West Virginia. I think we're the only other one in West Virginia. There might be one more that's in the process. So we're a really unique entity. And while they are our fiscal agent, and we're very grateful for that, there's a lot more opportunity out there if we can figure out a way to get around that obstacle.
Right. All helpful information. Thank you, Michelle. We have certainly more questions for you that will be coming, but we're going to segue on to Brandy. Our final panelist is Brandy Browning, Director of Community Services for Pride Community Services. It was organized in 1957 during a time of extremely high unemployment in the local coal fields by a local group of women. I really like that. Pride stands for Progressive Rejuvenation, Improvement, and Development Enterprise. She's been employed there since 2016. She was hired as the Child and Adult Care Food Program Coordinator. In 2017, she was promoted to her current position, Director of Community Services. She supervises the Community Services Block Grant, Emergency Services Program, Child and Adult Care Food Program, Support Services for Veteran Families, and the IT Department, which it cracks me up because, Brandy, that's a lot of stuff. Through programs, she assists the low-income members of the community to meet their immediate basic needs, which include utility assistance, emergency housing, and food assistance. Thanks for joining us today, Brandy.
Thanks for having me. I just want to say, give you a brief overview of our services that we provide. We have many different programs here within the agency, and the main goal of all of those programs is to help low-income families or seniors, children, as best we can, whether it be through services here in the agency or referring them out to other agencies, that can better serve their needs. Of course, we have our Head Start program, Weatherization. Weatherization serves houses that need energy reduction to lower power bills and stuff for low-income people. We have our senior services that focuses on the feeding seniors 60 and older. Of course, our nutrition sites are closed right now, but all our seniors are having home delivered meals. Also during COVID, the Bureau of Senior Services set up grab and go meals so that the seniors just drive by 2 times a week and they can pick up meals for their whole family. We also have the in-home services for seniors, where we have homemakers that go inside the homes of disabled seniors that are not able to take care of themselves on a daily basis with daily living tasks. So that helps out a lot. We have the supportive services for veteran families, and that program it helps homeless veterans or those that are at risk of homelessness, I apologize, with finding housing. We use supportive services, case management, all the resources that we can, We also provide temporary financial assistance to help them find housing, and it's all based on their income. The Build Jobs Initiative is a on-the-job training program that Pride has currently. The end of the program is unfortunately this June because the grant is running out, but we have partnered with the Fresh Start program and included some of their participants that are interested in the program. Participants learn different trades, including plumbing, HVAC, carpentry, and electrical. Some of those Build Jobs participants have also been hired on here at Pride. So, they also face employment. It's a 16-week on-the-job training program. The Emergency Services Program, it is designed to help low-income individuals and families meet their immediate needs. We help with utility bills. We help with food. We help with emergency housing. And through this program, we have also helped with at Hungry Lambs. We have donated masks during the pandemic. We have had a couple people go down and set up tables and hand out information about all of our programs. We have handed out hand sanitizer, and we have also, we're expecting any time now, we have ordered a 24 pallets of hand sanitizer that we will be able to hand out to our community partners to help the community in that way. So we're just expecting that anytime. We see a lot, especially seniors, a lot of seniors that we deal with every day. They'll just break your heart because, they say it's either I pay my electric bill or, I buy food. I can't do both. In that instance is when we say, okay, we've got food boxes, shelf-stable meals. We pull out the list of food pantries in the area. We give them information about it. We invite them to our senior centers for, at least that one hot meal a day and the socialization with their peers. Just different things, it's not all about what one program can do. It's just what we can do as an agency for each person that comes through here. During the COVID pandemic, when it first started, of course, our weatherization crews, they were unable to go into the homes. And our executive director was on the ball. She organized everybody to, whoever she could, to go out and find shelf-stable foods that we could make food boxes. So during the pandemic, when most staff went home, the weatherization crew and our cooking staff was here. Weatherization crew, they boxed up, I'm going to say probably 200 at first, 14-day food boxes. And we had processes to where staff at home, including myself, would take applications and, people call in, say they needed food. Our weatherization staff would deliver those food boxes. Our seniors, they continue to receive their home delivered meals on a daily basis. And we're still doing the home delivered meals because the Bureau of Senior Services hasn't allowed us to open the senior centers yet. But we powered right through the COVID pandemic. Not many changes had to be made as far as our services. Of course, everybody got, pretty tech savvy working from home. But in a nutshell, I think it's, everybody done a great job. All of our clients were taken care of, all of that. Our Build Jobs program, we have actually assisted the Fresh Start program and Hungry Lambs with the building fruit stands for their farmers market. We have just done that a few months ago. So, there's different ways that we partner with local agencies in the community. What else? Trying to think. I guess that's just the basic overview of everything that we do here. I'm sure, there's plenty more, but, mainly somebody comes in, we make sure everybody does an assessment, all staff, and so we just go from there.
So let me ask you a couple of questions, because I think that, your organization, you're a community action fund, but you're also really unique in how kind of entrenched you are in your community. Can you kind of explain the difference between what the community action part is and how you're more than that?
Well, the community action part is, we are grant funded and stuff. We have the community services block grant, which is, sent down from the federal, it's a federal grant. And it says we have to operate a certain way, but we also have all these other programs that are designed to assist people in the community. And, we want to get out there and help people in the community and partner with other organizations. And there's so many different things that, we want to do, and we've tried and all that stuff, just for the community.
Can I ask you, how do you, because, when we started the process of planning this series, I found that everybody worked with you all. So how do you get engaged with so many different organizations in your community? I mean, do you have like an outreach person? Do you have monthly meetings? I mean, how do you know what people need?
Well, that is brought on by our intake. Every client that comes through here, they have to complete an intake form. And we have really good staff that, like our Head Start family advocates, they work with the Head Start families, and they do assessments. Every program completes assessments as to what this family needs, and a lot of times, somebody may come in for assistance with the power bill, and they may ask, well, do you help with food? Do you help with transportation? I have a senior citizens, in my family, and they need this type of assistance. It's casual conversation, but a lot of it is with the partners. It's just our different programs. And, if somebody calls and says, they might need something that we can't, we don't have a program for, then, we may look out into the community and say, okay, so, Fresh Start can do this for you, or, you can give food to hungry lambs, just different ways.
We appreciate that. What kind of, I find so refreshing by all three of you is, you say this, you're all three big believers in people power and finding the right people and really valuing the people who are doing good jobs. But then you all just kind of say, well, this needed to be done, so we did it. And often it's like, well, if nobody, many communities, don't have people who make that response. So it's really wonderful to hear what you all are doing. If Michelle and Chad, if you can turn your videos back on, I'm going to go to the Q&A box, and then we're going to ask some of the questions that we have pre-prepared. So the first is from John. Who says, has any consideration been given to forming a coalition of sorts that supports the community needs across the board, i.e. food, behavioral health, trauma, youth, elder care, to maximize grant opportunities? I think it would also add mass to address needs rather than a more piecemeal approach. What are your thoughts on that?
Absolutely agree. And I feel like we are informally doing that. We do collaborate a lot, but we met with Pride. Gosh, Brandy, when was that? I feel like it was right before Christmas, and we talked about maybe doing a power grant together.
Yes.
And it just we definitely need to do that. We don't have a formal name for it, but the Wild, Wonderful, Healthy Logan County, I think they have been doing a lot of that for food insecurity and like improving the health in Logan County, a very collaborative approach through them. But we don't have a formal coalition that we're all a part of. And we just don't have a name for it. And we haven't applied for a big grant together yet. We've talked about it, but Brandy, am I missing something?
No, I agree with what you said totally. I totally agree that, everybody wants to help the community. And, it surprised me when I first started in this position that certain organizations, shied away from wanting to work with Pride, and I'm like, okay, we're all in this together. Why can't we partner and, benefit more people, make them have even more, get more out of it, their needs and stuff met. So, I totally agree.
And we do. I mean, we definitely do partner a lot together. And I feel like that informal coalition has grown since the pandemic started. I think our next step would be to maybe formalize it a little bit and apply for some grants. But we all definitely do work together, and we have been, we definitely sign partnership agreements a lot for different things, but together to name a coalition and maybe go for some big grants probably is a very good idea.
Yes, it is.
Brandy, Pride is a 501c3, correct?
Yes.
And Chad, is Hungry Lambs a 501c3 as well?
Yes, Hungry Lambs is.
Okay, so Michelle, you had mentioned, are you all entertaining the idea of becoming a 501c3 or perhaps partnering under one of their umbrellas?
Well, I don't know. We have a board meeting on Friday, and so I guess the board will steer me in that direction. We want to apply for one of the Palatine Foundation grants, but we have to be a 501c3 to do that. And, basically the current grant that we work under funds salaries. And so I don't know how we would, I can't ask Hungry Lambs, for example, to fund employees. So they're just not really, Hungry Lambs they're just not really equipped to do that. So I guess, I don't know, we're running out of time, but I will find out on Friday if what direction the board wants to go in. The last time I brought it up to them, they, it just really wasn't something that they felt like we needed to do. But now with Fresh Start's grant sunsetting in September, I think we're going to have to rethink that and figure out what we're going to do. So
if there's a way we can do it, we will do it. We will help in whatever capacity we can help. So if it's something to keep the program going, we will manage it and we will figure out a way to make it happen.
Right. The next question comes from Katie, and she says, a Fresh Start farmers market is a wonderful idea to combat food deserts. Congratulations on your continued success. Do you have a timeline for the start of the farmers market?
Well, we're hoping May. I mean, we're hoping at the end of this month, we're ready to go. The Pride Build Jobs program built absolutely beautiful farmers market stands, and we received, today in the mail, the letter from the agriculture commissioner that it's been approved. So we've been waiting on that to come in. The county commission may be helping us with finding a farmers market coordinator. And so, we're right there ready to start. So anytime. We just have a few more little things to iron out and we're ready to go.
Great. The next question is from Jim, who says, I apologize that I got here late, and this may have been covered, but does Hungry Lambs utilize the food banks to purchase food at a very cheap price? They may also have senior and veteran food boxes available.
Yes, we do. We get the majority of our food from Facing Hunger out of Huntington. They do send us the senior boxes. We get a shipment of those once a month, which actually I'm getting the delivery on this Thursday. And that's something that we talked about before, Michelle's Fresh Start program. They will be there to help us unload the trucks. The senior boxes are the people you have to fill out a form. We send those in to Facing Hunger in Huntington, and then they determine who is eligible for the senior boxes and who is not. We have people that are on what's called an active list, and then we have people that are on a waiting list. So when we do the distribution, we have to check off if that person came to get their senior box. If they don't come, then we try to contact them, give them little bit of time to maybe come and pick it up. And if they don't, then we can go onto the waiting list and start out with the person number one on the waiting list. Then they will receive a box, and just so on from that way. But we do get the majority of our food from Facing Hunger in Huntington. Some things are free. Some things we have to pay. It's a very small fee for. But then we actually place orders through Kroger's. I have a friend that is an assistant manager at the Kroger's in Danville, and they always help us find the best prices on the items that we want, and they will order them for us, and then we go pick it up and bring it back to our food pantry.
Kelly, can I back up a second? I feel like I'm nervous and probably just skipped talking about this, but I don't think that I said that the farmers market and the tool library were funded through mini grants from Try This. And when you said the name Katie, it made me think of that. So I apologize for not, giving credit for that, but Try This grants is what funded the farmers market, and that was through Pride. Brandy, you guys wrote that grant. And then the Try This grant in Lincoln County was through the oh my goodness sakes, I can't remember, but anyway, the FRN in Lincoln County. So I feel like I should have said that, and I apologize for not. I'm just talking too fast, I think.
All right, but it certainly shows that there's a lot of moving parts in trying to keep these things afloat. The next comment is from Foster, who says, honored to work with Michelle, Brandy, and Chad, along with others at the Fresh Start program. Jobs and Hope West Virginia is here to support the programs you all are hosting and supporting. Recently, about 10 participants in the Logan County Day Report went through a greenhouse and lawn and landscaping course to not only educate them on the techniques for their community service right now, but also career training opportunities. 2 of those active participants were very interested in opening up their own agricultural business so they can provide for their families and community.
Yes, cool. It was really cool. And though the certificates came in the mail late last week, and the participants were like, I wanted to get a frame, and they wanted their certificates. Like, I hadn't even got a chance to get the frames yet, and they wanted them in their hands. And they are very eager to do more trainings and to get more opportunities to learn as much as they can. And so, yeah, we're very appreciative of that program, and Patriot Gardens and just everybody that was involved in making that happen for our clients. And my goodness, when those certificates came in, the stuff that they learned, I don't know if I could have done it. It was really great, a really educational program, and they were thrilled to do that and go every day. And they were there all day for 5 days a week. And they really, really enjoyed that opportunity.
And that was done in hopes of the grant that has been written that for the greenhouse, that in hopes that we will get that greenhouse. So if that grant comes through, they will be ready to go and be trained and know exactly what to do with the greenhouse.
That's awesome. We've heard in the first 2 that gardening has become increasingly popular due to COVID and people needing to do at home. Foster added, maybe we can collaborate on how to provide employment funding to some of those interested folks to continue your initiatives.
That's right.
Yeah.
Great.
So let's move on to some of the pre-prepared questions. And folks, if you want to add any questions at any time, feel free to type them in the Q&A box. All of you seem well entrenched and engaged in your communities. How would you describe your relationship with your community? And do you think the sense of community is an essential component to addressing good health and food insecurity in Logan County?
Michelle, you want to go ahead with this one first?
I feel like I keep answering. I talk too much. Yeah, absolutely. I think that the whole sense of community is essential to everything. I think it's, from my perspective, it's essential to building a recovery community and helping Southwestern West Virginia rebuild from the devastation that the opioid epidemic and now the stimulant epidemic has caused. I think that I want to be engaged in my community in a lot of different ways, coaching sports teams and civic clubs. And I just think that that's the way you build build collaborations and you work together. And, you know, I think that's the only way that a community grows and thrives. And I just use every opportunity I have to talk about, you know, the needs that I see in this community and what we can all do together to make it better. So.
Brandy or Chad, you want to answer that one?
I mean, I have to, agree with Michelle that
Yeah.
with basically everything she said, you just have to be out in your community and show people what you're doing. And if you let people see what you're doing, then that gets them to want to be involved with it also. And you just got to be vocal and let people know what's going on.
Great. We got another remark from John saying, Brandy, did you have something to add before I segue over?
No.
Okay. He said, I'm trying to push forward a community garden in Browntown, Barber County. The objection I always have thrown at the idea is theft. I realize you can't guarantee total property safety, but how do you or how have you worked with those concerns?
We have had, knock on wood, no problem whatsoever with any theft at all from our community garden. And it honestly is in an area that is not very well traveled. It's it's beside of the railroad tracks next to our local dog pound. So it would be very easy for someone to come in and steal everything that we have and no one would even know. But I mean, we haven't even lost any vegetables. I mean, let's put it that way. The eggs that we have from the chickens are always there. Nothing is locked. We don't have a lock on anything down there. So it's just the opportunity is there for someone to steal if they want it. But they have kind of, I think, because where we have talked about what we are doing and what the vegetables are for, what the eggs are for, that they are going to the food pantry, that people just kind of leave it alone. They don't mess with it. But we also, Michelle and I hear all the time, people say, we drove down there to see the chickens. We drove down there to see the vegetables. It's beautiful. We can't believe that this is happening. So, people that aren't even involved with it are taking pride in it and respect it and want to see it do well. So no, we have had no problem with theft at all. Not like
Well,
I said,
we do have cameras though. We do have 2 county cameras that because of where the dog pound is in the water company, you can see the garden, but never once have we had to roll back footage to see if somebody took something. But I mean, I can pull up the cameras if and look, but haven't had that problem. We had a few eggs, but we're not sure what happened to those. It could have been an animal or something.
Yes.
So
we did have some problem with when we started out with our chickens, we had about 80 hens, and over the last few months we have lost numerous hens, not due to theft, but due to something got in the hen house and has killed them. So Michelle wasn't real happy with me here in the last few weeks, jokingly. We have now an additional 120 baby chicks that we are raising in the hen house. So we're going to get back to where we were and be able to provide a lot of fresh eggs here, hopefully within the next couple of months.
That's nice. I'm sorry about your chickens. John says, Chad, that is so awesome and validating. And I agree, communication is totally necessary. So let's move on to the next question. This is session 3 of the Summit Series, and until now, we haven't discussed the role that substance use disorder and all the rippling effects that it has had, and how challenging it has been on our communities to keep them intact. Can you talk a little bit about those challenges?
Michelle, that's you.
I mean, yeah, it has been challenging, and Logan County is seeing a surge of overdoses and sadly overdose deaths since about May or June of 2020. I think that, again, it goes back to education. And, I still get some pushback. There's still a lot of stigma surrounding substance use disorder, but the more that you can educate folks that it is a disease and that people do recover, treatment does work, people can regain a life again, and then show that and celebrate that. I really think that, keeping this community, keeping it intact means that everybody has to recognize that we are, this whole community, this whole region has been victim to the opioid epidemic. Gosh, it just takes a lot of work to build a recovery community, to support a recovery community, and to not kick people when they're down. And so, feeding folks who, okay, maybe they did spend their last dollar on heroin, but they're still human. They deserve food. They deserve to have a roof over their head. They need a lot of support. They need for people to constantly, offer them resources for treatment. There's not too many chances that can be given. Supporting grandparents who are raising their grandchildren. In Logan County, the numbers are just astonishing how many grandparents are raising their grandchildren because of the effects of the opioid use disorder, epidemic. And so supporting those grandparents, I'm one of the people that goes car to car and finds out how many people are in their family and how many families, and the stories you hear in that line, talking to those folks in that food pantry, really, for me, speaks more than the statistics of what folks have had to do to keep their families going and to get their grandchildren raised. But I really think a lot of the support needs to go to the recovery communities if we're going to keep our communities intact.
Thank you. Chad or Brandy, you want to share before we move to the next question?
No, I think Michelle hit everything there.
Okay. Good segue. Does stigma affect the work you do? Do you think it stops people from accessing resources? So we've heard from providers who said, sometimes we don't know if our patients are food insecure because they won't tell us they're too proud. So is that something that you address in the work that you do?
Yes. We see it a lot. There is a lot of stigma with people that are coming to the food pantry. Like I said, we see new people almost every month. Sometimes they might be driving very nice vehicles, but they have come upon hard times, especially during the pandemic. We have had people that have lost their jobs that never in their life have ever had to come to a food pantry, and it's very hard for them. So when people do come, we treat everyone the same. I feel, to me, I'm no better than anyone else. I feel like everyone's equal. We just, we talk to them like it's a normal day. Just, hey, how you doing? Just try to be as normal as you can, and to make them feel more comfortable when they're there, because I can't imagine myself having to go to a food pantry to get food. So I try to put myself in their shoes and try to look at it from their standpoint and just make them feel as comfortable as they can be when they come. So that's just what I do, the way I feel about it. So
I totally agree with Chad. We see it all the time, especially people come in like help for power bills, or if they don't have any food and, they're calling us or looking for food boxes or whatever. I've had people just sit and cry because they were so proud of themselves and want to do it on their own. And they would cry because they had to come and ask for help,
right.
And then, that's when I never will forget it. I'll tell you this just real quick, because I love this story. I was helping a senior with Medicare. She had worked all of her life, had recently got disabled. She was on Medicare. She went to the pharmacy to get her prescriptions and found out that she didn't have a drug claim. So she comes here and, I'm helping her get her drug plan. And I even called to get it started quicker, so she could have it covered and wouldn't have to pay cash for her medicine and everything. And she gets a text from AEP that she's getting a termination notice. She starts bawling and crying. And I'm like, ma'am, what's wrong? What can I do? What's going on? And she says, I just got a notice from AEP, a termination notice. And she's bawling and crying. I can't buy my medicine and pay my power bill and all this stuff. And she said, I've never had to do this before. I've never had to rely on outside assistance and those different things. And I'm like, okay, let's get your Medicare taken care of. We have a program that will help with your termination notice, And she was beyond grateful. I thought she's going to give me a kiss on the cheek and hug me before she left. It was just, it's one of those stories that, this is what we do, but we do see it all the time also.
Thanks for that. We have another comment from John that says, just as the Fresh Start program is a way to reintegrate people back into the community, aren't these other programs like a community garden a way for the rest of the community to recover from poverty, trauma, etc.? Pure economics to take root. These projects give hope. Thank you, John. Let's move on to question 4. We'd like to get more people involved in volunteering in their communities, whether they're in Logan or not. How would you recommend they start getting involved?
Well, kind of like I said before, you just have to be vocal about it and tell people and let them see what you're doing. The video that you showed earlier that we did, after we put that video out, we were contacted by numerous people wanting to come and help. And so we have no problem getting volunteers. But again, it's just, you just have to tell people what you're doing and let them see what you're doing. And then they will get involved. If they ask, bring them down, have them do anything you need. And once they get there and start doing something, then it just kind of keeps going and going and going, and they get more involved, and then they get more people involved. And, that's just, in my opinion, that's just the way you need to do it.
A lot of folks will say, well, just tell me if you need any help. So what I've found is helpful is to give them a job. Well, on Tuesday, we've got about 200 boxes that need filled. If you could be down there at 1 o'clock and help us fill those boxes, because people want to help, they just don't know what to do a lot of times. Or, maybe they, we just try to give them some things that need done, and they can tell us, what they are able to do with their schedule and with their, personal commitments. But a lot of times people just they want to help, but they don't know how. So, I think that giving people a job is right. Has been really beneficial for us.
We found that too, as this project has unfolded, that people like picking a specific job, kind of just not just show up and we're not sure what we're going to do, but this is what needs to be done on here, and can you do it? Then people feel kind of an ownership of it. They know what to expect, and people seem to really appreciate that.
On December the 18th, which was cold and rainy and miserable, we did a community resource day in partnership with that monthly food giveaway, which is the big one because it's right before Christmas. So we had, I know Pride was there, and we had suicide prevention. We had the Coalition to End Homelessness. The quick response team did Narcan distribution. The health department came and went car to car and talked to folks about COVID testing, as well as the upcoming vaccines and what to expect, giving out information. Prestera came and did a lot of stuff. The Prevention Coalition came and gave out coloring books to the kids about, not using drugs. The Day Report Center had staff there who could link and refer people to substance use disorder treatment. Goodness, we had tons of tables set up, and we just had one meeting and we said, this is what we need. Can you guys do it? And every single organization that we asked showed up and helped. And it was a huge success.
It basically was going to be one group there, and then it just turned into, like Michelle said, numerous agencies showed up and worked that day.
And when I saw the weather, I thought nobody's coming, but everybody came.
Okay, let's move to, and just a question, is there in Logan County, like any kind of centralized resource, if there are like volunteer opportunities where people can access? I don't think we've seen many.
No.
Okay.
Pride actually tried to start right before the pandemic started, a volunteer services program. We received a discretionary fund through CSBG funding, and we had it set up to where we would screen the volunteers to go into homes of seniors, and stuff. We'd actually do background checks and stuff on the volunteers. So because, seniors are one of the most vulnerable populations. Unfortunately, we weren't able to get that up and running, but, we still want to do something like that to where, we can say, yes, Joe can come and cut your grass, next week, what have you.
Well, that would be really helpful, I think.
Yes.
Okay. If someone comes into Hungry Lambs and that you need medical attention, what do? You may just need to point a finger and say.
Right. Well, I mean, like I said, we've had the satellite health department there set up, pre-pandemic. But after the pandemic, we've I talked about that a little bit before. We've had the ambulance authority there that's been doing the COVID testing. We've had people from Coalfield Health. So we always seem to have someone there that if someone does need medical attention, it's right there. If not, then I'm on the phone calling the health department, or if it's someone that might need substance abuse treatment, of course, Michelle, if she's not there or someone from her group isn't there, I'm on the phone with them. So it's not a problem. If like 90% of the time someone is there that can treat someone. If not, we can have them there within minutes.
That actually did happen. A mother and her teenage son came through the food pantry line and asked if anybody there could help him with the substance use disorder. And there was someone with West Virginia Higher who is housed in the Community Resource Center was there and linked him to treatment and got him in that day. Yeah, that's happened.
Anything? Okay. Question 6. It's a long one. We started working on this project to build better bridges between healthcare and food resource providers like Hungry Lambs. But do you think that the state and communities would benefit if we created a more robust network of pantries across the state, ones that received state funding and support? What would be the benefits and drawbacks?
I definitely think that would be beneficial. It would just give us more opportunity to be able to receive more food. And when I say more food, I'm talking about different types of food. When we get our deliveries, we're mainly getting just canned food and boxed food, things like that, which is great. It's needed. But, as we talked before, we need more fresh vegetables and fresh foods and things like that. So if there was any way that something like that could be set up through the state, would be of great benefit. And honestly, I don't see any drawbacks from it at all. So I don't know, Michelle, you and I talked about this a little bit last night, and I know you had some ideas, so I'm gonna let you kind of touch on that also.
Well, when we were talking about this, we were talking about like the Food and Farm Coalition and, right. Continuing to fund and support that because Spencer with Food and Farm, we were at a wedding sitting across from her, telling her the same story out, talking about it. And we were able to secure funding through her to get fresh vegetables over the summer, this summer, to enhance what we were able to give. And I think you got some fresh meat too, right?
It was near the end of the last summer. And so it was kind of right at the end of the growing season. So we were given a few $1,000s from Food and Farm Coalition, which was absolutely amazing. And I was able to purchase bushels upon bushels of fresh corn on the cob, tomatoes, peaches, zucchini, squash, everything. And then the growing season stopped and we had some money left over. So I spoke with Spencer and we were able to, she got me in contact with a local farmer that raises cattle, and they were able to get me fresh ground beef. We were, with the money that we had left over, we were able to purchase, I believe it was around 700 pounds of fresh ground beef that was all individually wrapped in pound packages. And it just happened that we had gotten a shipment of hamburger helper from Facing Hunger. So we were able to take the fresh hamburger and put it with that. So that provided a great meal for families. So if we had more things like that, it would be absolutely wonderful where we could get fresh foods.
The idea that the Logan County Resource Center has, where so many different resources are housed in the same place, if there were more of those across the state that the state could fund, that center, that location has just, and it's just expanding and growing, but it has given us so many opportunities. And so if every county could have one of those that the state could support, I think it would be very beneficial. One drawback might be just, that if you constantly have to write grants and turn it and manage it, that's hard. I mean, that's time consuming, and that would be one drawback that I would see. But the benefits, I'm sure, outweigh that.
I think that as we've held these sessions and had conversations, one of the biggest drawbacks, I think, in the work that you all do is the grant funding. It's the trying to find the money, and then how do you sustain it once it goes? And often the grant will say find sustainability, but when you're in a rural community where there are precious few resources, it becomes very difficult. A good way to provide sustainability is to ensure that there's state funding that comes down on an annual basis, at least to try and keep things afloat in some capacity. Judith has a remark to share. UWA of the Mid-Ohio Valley, so that's United Way Alliance, has put a volunteer program in place in Wood County. They are putting together a list of volunteers and ask food pantries and other agencies in the area if they are in need of volunteers. A central sign up for volunteers would be helpful to many. That sounds like a great idea. And if you could share information about that with me, Judith, I would love to share that with the other communities that we're working in. And so let's take one more question. I think we'll be at the bottom of the hour. What would you consider the biggest challenge you face in maintaining or increasing services to meet the demand?
It would definitely have to be the money to fund what we do. We rely solely on donations. So, that's the thing. Like I said, we're fortunate enough that Facing Hunger, the majority of the food we get from them is free or at a very reduced rate. But there's a lot of times that we have to fill in for things that we need. And so, every time we call Kroger's to make an order, it's $5,000, $6,000, $7,000, $8,000 that we're spending. So the money is our biggest problem in maintaining the services that we provide. And like I said, we are basically on donations, and we just started recently, Michelle, with her help writing some grants to get some of the other funding that we need.
Good point. Brandy or Michelle, do you have anything to add? What your biggest challenge is?
I agree here, because we are all grant funded, every program we have. And, that's the biggest challenge, like our Build Jobs program. We would love to keep it sustained through another grant or something, but, the grant ends the end of June, especially for our second chance people, like the people from the Day Report and the Fresh Start program. But, that's the biggest issue we face.
And I just want to say, for those of folks who don't write grants for a living, they can take a lot of time, and you don't always get funded. And so you find yourself writing and reporting a lot of stuff for maybe $10,000, which can take a lot of, if you're wanting to expand services, it can become very difficult to stay on top of things. So we're at the bottom of the hour. Do you have any last words from our panelists? Anything you'd like to share?
I agree here, because we are all grant funded, every program we have. And, that's the biggest challenge, like our Build Jobs program. We would love to keep it sustained through another grant or something, but, the grant ends the end of June, especially for our second chance people.
Okay, well, we're very thankful that you joined us today. It was a great conversation. I look forward to sharing the video on our YouTube channel tomorrow and hearing additional thoughts that people have. Many thanks to the panelists, to the Palatine Foundation of Huntington, to attendees for this great conversation. We hope to see you on social media to continue the conversation. And I hope you'll join us next Tuesday for session 4, Good Food is Good Health. So thanks again and have a great day.
Thank you.
Thank you.
Bye.